So you're the ER doctor and you've got 5 patients that are waiting to be seen. You've got someone with chest pain, an overdose, a kid with fever, a car accident, and a mental health crisis. Let me walk you through how I would delegate tasks and in which order I would see the patients. Triage never stops in the ER. It isn't just at the front desk, it's something that every doctor is constantly doing as new information comes in. The first thing that I would do is I would send patient A with chest pain for an ECG and blood work because these tests can catch subtle signs of a heart attack. I then ask my psychiatric nurse to bring patient E, who's coming in with a mental health crisis, into a quiet assessment room and to get a more detailed history. The first patient that I'd go see myself is patient B, who's coming in with the overdose. I'd check her pupils and her breathing and make a decision on whether she needs more naloxone. Next, I would go see patient D, who was in the car accident. That means I would do a full trauma assessment and then order things like blood work, scans, and pain medications if necessary. I'd then go see patient C, the kid with the fever, and determine if there's any concerning features for a serious bacterial infection that would warrant further investigations or antibiotics. Then I'd circle back to patient A, review the ECG, and do a formal assessment. And lastly, I would review patient E's assessment by the psych nurse and then sit down with the patient myself to do a medical and psychiatric exam and decide on the best treatment plan. At this point, I'd pause, review all the results and plans, and re-triage based on what's changed. This example is obviously simplified, but the constant juggling, delegation, and time pressure is exactly what it feels like to be an ER doctor. Now imagine doing this for 20 patients where lives are actually on the line. So if you're ever in the ER and you're frustrated or wondering why you weren't seen in order, this is what's happening behind the scenes. Let me know in the comments if you would have done things differently.